Can Alzheimer's disease cause us to forget our memories, who we are, and our loved ones? While this may seem like a frightening possibility, understanding the progression of the disease can help us learn how to fight it. So how long do the stages of Alzheimer's last, and how does the disease progress? How can we recognize the stages of Alzheimer's? How are the final stages of Alzheimer's identified? What are the support and treatment options for Alzheimer's patients? If you're interested in learning more about these important topics, don't forget to support us by subscribing, liking, and leaving a comment or emoji below. Alzheimer's disease is a challenging journey for both individuals and their families. Understanding the disease and accurately identifying its stages is critical for developing appropriate treatment and care plans. Doctors determine the best treatment methods for each stage to support both the patient and their family. Family members also need to be actively involved in the process. First, let's answer the question, how long do Alzheimer's stages last? Alzheimer's disease is a progressive brain disorder that lasts for many years. Each stage is characterized by a significant decline in cognitive abilities, and over time, the individual becomes increasingly dependent on those around them. Although it is possible to distinguish between the stages of Alzheimer's, the duration of these stages can vary from person to person. The first stage can last up to 20 years. In the early stage of Alzheimer's, symptoms such as mild forgetfulness and difficulty concentrating may begin. However, these signs are often mistaken for natural aging and may go unnoticed by the patient or their loved ones. This stage can last for up to 20 years. Early intervention and appropriate treatment can extend the duration of this stage or slow the progression of the disease. In the second middle stage, the individual's independence decreases. As the disease progresses, memory loss becomes more noticeable, and individuals may struggle with daily tasks. At this stage, they may get lost in familiar places or have difficulty remembering names and faces. The middle stage is one of the longest, lasting between 2 and 10 years. It is during this stage that patients require more professional support. The third and final stage typically lasts between 1 to 5 years and requires significant care. The last stage of Alzheimer's is when the patient becomes entirely dependent on others for care. They are no longer able to perform basic daily functions, and abilities such as speech and movement decline significantly. Organ failure and infections are common in this stage. This period generally lasts between 1 to 5 years and often ends in death. After explaining the 3 stages of Alzheimer's, let's move on to how can we recognize the stages of Alzheimer's? Recognizing the stages of Alzheimer's is crucial for improving the patient's quality of life and ensuring that appropriate treatment begins in time. Alzheimer's is typically identified through its symptoms, but these signs can often be overlooked or misinterpreted. Accurate identification of the stages is possible through regular doctor visits, testing, and careful observation by loved ones. What are the early stage symptoms, and what does the care process look like? In the early stage, symptoms may be mild and often confused with natural aging. Individuals may experience slight difficulties in their daily tasks, forget recently learned information, and occasionally struggle to find the right words. At this stage, patients are usually still independent in their social and professional lives, but attention lapses and forgetfulness may gradually increase. Neurologists typically diagnose early-stage Alzheimer's through cognitive tests and brain imaging techniques. Doctors may use various cognitive tests to determine whether memory loss is due to Alzheimer's or another condition. Family members may start to notice small changes in the patient at this stage. However, these symptoms are often not seen as severe, and doctor visits may be delayed. Regular checkups during this stage are essential for early diagnosis. Offering psychological support and helping the patient maintain their household responsibilities can ease the process. What are the middle stage symptoms and care requirements? The middle stage of Alzheimer's is when patients begin to lose significant independence. Memory loss becomes more pronounced. The patient may forget the names of loved ones, get lost even in familiar places, and have difficulty completing daily tasks. At this stage, the patient can no longer manage their personal or financial affairs. Doctors typically focus on medications during the middle stage to slow the progression of the disease. While these treatments don't stop Alzheimer's, they may alleviate some symptoms and help the patient better cope with daily life. In addition, physical health complications, such as falls or nutritional problems, may arise at this stage, Family members may need to take on more responsibilities during the middle stage. The patient requires more care and supervision, and professional care support can be a great relief for both the patient and their family. The emotional fluctuations patients experience during this period, including restlessness and anxiety, may require psychological support for both the patient and their family. Now let's answer the question, what are the final stage symptoms and does the patient require full-time care? The final stage of Alzheimer's is when the individual becomes completely dependent on others for care. They can no longer move on their own, lose their ability to communicate, and may struggle to eat. In this stage, the patient may become bedridden and the risk of infection increases. Organ failure and rapid deterioration of overall health are common. Doctors in this stage typically focus on managing symptoms and improving the patient's quality of life. Pain management, nutritional support, and infection control are primary concerns in the final stage. Family members may need to seek professional help for full-time care in this period. As the patient becomes entirely dependent, constant care and supervision are required. It's also crucial for family members to receive emotional support during this challenging time. How are the final stages of Alzheimer's identified? The final stage of Alzheimer's is the most severe and typically the shortest. During this stage, the patient's cognitive abilities are nearly completely lost. Mental and physical functions rapidly deteriorate, and the individual can no longer live without assistance. Organ failure is a common occurrence during the last stage and is often the cause of death. Patients in the final stage are usually unable to speak, move, or respond to their surroundings. They are highly vulnerable to infections, and most patients die from complications related to these infections. What are the support and treatment options for Alzheimer's patients? While there is no cure for Alzheimer's, various treatment methods can slow its progression. Especially in cases diagnosed early, medication and cognitive therapy can improve patients' quality of life. Alzheimer's disease is a complex journey that affects not only the patient, but also their family and loved ones. One of the most critical factors in coping with this disease is professional support for both the patient and their family. If you found this content helpful, please don't forget to subscribe to our channel and like our videos.